Nurse Aide Exam. Question 1. The best way to communicate with an unresponsive client is to: Option A. Avoid talking to them since they can't hear. Option B. Speak to them as if they can hear and respond. Option C. Speak loudly near their ears. Option D. Only speak to family members. The correct answer is option B. Speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 2. The nurse aide enters a client's room and finds the client on the floor. The aide should: Option A. Pick up the client immediately. Option B. Assess the client, call for help, and do not move the client. Option C. Leave the room to get the nurse. Option D. Document the fall and call the family. The correct answer is option B. Assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 3. Which task is outside the nurse aide's scope of practice? Option A. Applying a gait belt. Option B. Recording output. Option C. Changing a sterile dressing. Option D. Offering a bedpan. The correct answer is option C. Changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 4. The family of a dying client is upset. The nurse aide should: Option A. Ask the family to leave. Option B. Offer support and a private place to talk. Option C. Ignore the family. Option D. Tell the family everything will be fine. The correct answer is option B. Offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 5. When is alcohol-based hand rub acceptable instead of soap and water? Option A. When hands are visibly soiled. Option B. After using the restroom. Option C. Before touching a client with clean hands. Option D. After caring for a client with C. diff. The correct answer is option C. Before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 6. How long should a nurse aide rub hands together with soap and water during hand washing? Option A. 10 to 15 seconds. Option B. At least 20 seconds. Option C. 30 to 40 seconds. Option D. 1 minute. The correct answer is option B. At least 20 seconds. According to CDC guidelines, hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing. Question 7. The nurse aide's primary scope of practice includes: Option A. Performing sterile procedures. Option B. Inserting urinary catheters. Option C. Assisting with activities of daily living. Option D. Administering medications. The correct answer is option C. Assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff. Question 8. Which is a violation of HIPAA? Option A. Discussing client care with the client's family who is present. Option B. Discussing client information in the elevator with another aide. Option C. Documenting care in the client's chart. Option D. Reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 9. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 10. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A, talk to the client regardless of response. Option B, sit quietly with the client. Option C, leave the client alone. Option D, ask personal questions. The correct answer is option B, sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 11. Which activity is most appropriate for a client with dementia? Option A, complex puzzles. Option B, simple folding tasks. Option C, reading medical journals. Option D, watching educational films. The correct answer is option B, simple folding tasks. Simple, repetitive tasks like folding towels provide a sense of purpose and are appropriate for clients with dementia. Complex puzzles and medical journals are too challenging. Watching educational films may not be engaging. Question 12. What should a nurse aide do if they experience a needle stick injury? Option A, wash the area and report it immediately. Option B, wait to see if symptoms develop. Option C, apply pressure to the wound. Option D, ignore it if no blood is visible. The correct answer is option A, wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 13. A client with a catheter should have perineal care performed. Option A, daily during the bath. Option B, at least once a shift. Option C, only if soiled. Option D, twice per shift. The correct answer is option B, at least once a shift. Clients with indwelling catheters need perineal care at least once per shift to prevent catheter-associated urinary tract infections, CAUTI. Daily is insufficient. Infection can develop within hours. Question 14. When measuring intake and output, INO, the nurse aide should record. Option A, only water the client drinks. Option B, all fluids consumed, including ice chips, soup, and gelatin. Option C, only oral fluids. Option D, only 4 fluids. The correct answer is option B, all fluids consumed, including ice chips, soup, and gelatin. Intake includes all liquids and foods that become liquid at room temperature, such as ice chips, soup, broth, gelatin, juice, milk, and water. Recording only water or oral fluids misses significant fluid sources. Question 15. Normal adult respiratory rate is: Option A, 8 to 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 16 to 24 breaths per minute. Option D, 20 to 28 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 16. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 17. When disposing of contaminated linens, the nurse aide should: Option A, shake them out before placing in the hamper. Option B, place them in a leak-proof bag without shaking. Option C, fold them neatly before disposal. Option D, sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 18. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B. Walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 19. A client with dementia is attempting to leave the facility. The nurse aide should: Option A, allow the client to leave. Option B, redirect the client to a safe activity. Option C, physically restrain the client. Option D, call security to escort the client out. The correct answer is option B. Redirect the client to a safe activity. Redirecting to a safe activity is the most appropriate intervention. The client may be looking for something familiar. Restraints require an order and are a last resort. Allowing them to leave is unsafe. Question 20. Range of motion, ROM, exercises are performed to: Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B. Prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 21. When performing passive ROM exercises, the nurse aide should: Option A, have the client perform the movement independently. Option B, move the client's joint through its full range of motion. Option C, force the joint beyond its range. Option D, perform ROM exercises only once a week. The correct answer is option B. Move the client's joint through its full range of motion. Passive ROM involves the nurse aide moving the client's joint through its full, pain-free range of motion. The client does not participate actively. Forcing beyond the range can cause injury. Question 22. Which precautions are used for clients with MRSA or VRE? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions only. The correct answer is option C, contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 23. When a client expresses a spiritual or religious concern, the nurse aide should: Option A, offer to contact the hospital chaplain or the client's clergy. Option B, provide personal spiritual advice. Option C, tell the client to pray about it. Option D, change the subject. The correct answer is option A, offer to contact the hospital chaplain or the client's clergy. The nurse aide should support the client's spiritual needs by offering to contact a chaplain or clergy. Personal spiritual advice is outside the scope of practice. Dismissing spiritual concerns ignores holistic care. Question 24. How should the nurse aide communicate with a client who has a hearing loss? Option A, face the client when speaking. Option B, repeat the statement. Option C, shout so that the client can hear. Option D, use a high-pitched voice. The correct answer is option A, face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 25. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations.